name is Edward Fakhre. I'm an orthopedic surgeon with subspecialty training in spine, so some would call that being a spine surgeon. And I'm joining Optim as one of the new orthopedic spine surgeons. I grew up in Tampa, Florida, somewhat native there, but I ended up doing a lot of my high school in a Caribbean island called Grenada. I came back to the US for college, back in Tampa, and then my medical training was mostly done in Washington, D.C., Georgetown, and that's also where I did my orthopedic surgery residency. Finally finished my training at Pittsburgh, where I did my spine surgery fellowship. And so a spine fellowship is 1 year dedicated entirely to the spine. In orthopedic residencies, you typically do dedicated blocks on spine of 3 to 6 months. The fellowship is 1 consecutive year where all you see is spine pathology, and you do a deep dive into the spine. The neck, the mid-back, the low back, and all of the conditions that can affect the spine, mostly degenerative, but also things like trauma, infections, tumors. So it's really a comprehensive and deep dive into the spine that you don't really get in residency. But what drew me to the spine was the massive difference in quality of life that you can make. And granted, everything in orthopedics makes a big difference. Everything in medicine helps people, but by doing one surgery where you leave pressure on one nerve, you can relieve a person's pain and restore them back to full function. I think in spine you have a potential to make a really big difference with your surgeries.